So huge thank you to all of the staff involved that are clearly following the right guidance in terms of infection prevention and control. I do know, I mean, these figures are just about what's on cases on our inpatient wards. I do know that we continue to support our service users in the acute trust in LTHT, our older adult liaison service that are being treated in the acute trust for COVID. And no doubt we'll have patients in the community, our service users and family members in the community that are experiencing COVID, and staff are continuing to provide appropriate care and treatment in the safest possible way. The figures that we report and that we're required to submit to NHS England are based on current cases in our own inpatient beds. So that's why you see sometimes the data might not represent your own experiences in your team. So huge thank you. What we've learned in terms of infection prevention and control and consistently applying that practice is what we're going to have to continue to practice for the coming weeks and months, and that's the best way to keep us all safe. So social distancing, that 2 metre rule rather than what's being debated about it, is really important. Keep washing your hands and wearing the correct PPE, and I'm going to talk a bit more about the latest government guidance in a moment. And as I've said, you know, these periods of stability around our inpatient units in particular are really important for our services, and it certainly helps in terms of managing staffing and staff feeling safe and protected as well. So as I just alluded to, we had some significant changes in policy announced in the ministerial briefing on Friday evening, and you'll have seen we've sent some comms out already in response to that. So in a bit of a pattern, we got the information through the news before we actually received any official guidance. So apologies. We do always want to be in the best possible place to give our staff clear guidance and be able to respond to any policy changes as speedily as possible. So people have mobilised now and have been working hard in the past few days to attend to these two specific policies in particular. Face masks and covering being required by all NHS staff and visitors. We're still waiting on some more detailed guidance, but in the meantime, we're working that through to look at how we would roll that out, because that's due to come in line at the latest next week. And visitors coming into our inpatient settings and the requirement for those to wear face coverings as well. And obviously that brings about changes to our visiting policies and procedures. And these are big changes. Because any change in people moving around brings an increased risk of COVID, and at the same time using PPE is not always comfortable, and it must be done safely and appropriately, because we know prolonged use of face masks can cause dehydration. If you don't use them correctly, it might give people false reassurance that they're not at risk of catching coronavirus. But the biggest risk comes from touch, which is why washing hands is fundamentally the best thing for people to do. So our priority is for all those people that are currently coming into our premises, our staff, making sure that we've got supply of masks and people are clear when they need to wear the masks and times when you can take the mask off, especially if you're in more spacious settings. And just to know, and I've had a question come through our admin staff that raised it with John, our Freedom to Speak Up Guardian, just this afternoon before we were doing the call. We did say at the start of the week that if you wanted to wear your own mask, then you could do. That's not necessary. So we will be supplying all of our sites and all of our staff with the appropriate masks that's been recommended in the national guidance, and that's the work that we're doing at the moment. I think what we're trying to allude to is we know that some people are already wearing face coverings in non-clinical areas because that makes them feel personally more comfortable. We didn't want people to stop doing anything at the moment that they personally felt kept them feeling safe. But absolutely, as an organisation, we will be rolling out those face masks to all of our sites and making sure that they're available for every single one of our staff. So thank you for colleagues that raised that question with John and for John for passing that question through, because we don't want anybody to be unclear and certainly not to feel as though we're not putting those supplies in place to keep people safe. And in terms of visiting then, there's further work that needs to be done because we need to manage visiting in a way which keeps our inpatient areas safe, because it's not just the process of visiting and whether you're wearing a mask, how many people can safely visit at the same time so that we don't end up with too many people in one place in terms of that inability then to maintain social distancing. What does that mean for frequency of keeping all of our areas regularly cleaned, more than we currently have from our domestic services point of view? what do we do in terms of routes in and out of our buildings to make sure that we are minimising the risk of spread of COVID as much as possible. So just not to underestimate, there's a lot of work going on behind the scenes, and as soon as we're able to issue that clear guidance, we absolutely will do. And this brings me back to the work that we've been doing for a few weeks now on bringing our other staff that don't work in inpatient settings back into work premises in a safe way and in line with the COVID secure standards that the government has issued. So again, already quite a bit of work going on. We've got a process in place, which is to go around all of our sites during the next 4 weeks to complete a comprehensive assessment of those sites. And then it'll be negotiating for the different teams that use them, which staff will come back in to use those sites and which staff can, if it's safe and appropriate for them to do so, continue to work remotely from home. So what we know is not all staff will be able to come back to work in trust premises. A bit like you're seeing in the debate that's taking place around schools at the moment, it's not possible to maintain the COVID secure standards and all staff operate out of our trust premises. So we're having to work through in a very thorough and systematic way to what's the right level of people working in our premises to keep everybody safe, and what does that mean in terms of individual staff and health and wellbeing and the ability to provide those clinical services. So that's work ongoing. The guidance, the principles that we've come up with is available now on the Trust website and has been circulated, and we'll just continue to give updates on those week by week. So I alluded to last week, we saw the publication of the report from Public Health England, which reiterated evidence that had already been shared about the disproportionate impact of COVID on our colleagues, our friends, our members of our communities from BAME backgrounds. And what we know, and what I was honest about last week, is the report didn't give the answers as to why. I think it's really important to be clear that the reasons for that disproportionate impact are complex. They relate to multiple factors that are connected to systemic discrimination, the way that we organise as a society, principles in terms of white privilege, and all the things that you'll have seen playing out in the news. So it's really important that we all take collective action in terms of addressing that disproportionate impact. Now, the one thing we've talked about, and the one thing that we've now rolled out, thanks to input from the Race Equality Network and our Equality and Inclusion Group, is the Staff Wellbeing Framework. So that was launched last Thursday. It's available for anybody to access on the website. And we're in the process of rolling that out now, with the priority being all of our BAME staff. That also includes our BAME bank staff, which we discussed with them at the forum, the bank forum yesterday. And of course, it's open to all other staff as well, but we want to make sure that we get comprehensive coverage for our BAME staff so that we've got the right support in place to manage individual concerns, risk factors, and so on. And again, we'll continue to give an update, and we're using our iLearn system in order to track completion rates of the wellbeing framework, as well as we'll take a temperature check and get a feedback along the way. So that's where we're up to with it. And just to move on from that, so again, in addition to the impact of COVID, again, we talked about last week, and we continue to see played out both in this country, in America, and around the world, the impact following the death of George Floyd in America. And some of you may have seen the coverage of his funeral yesterday, within the last 24 hours into last evening. Should we be surprised that it's released a huge depth of feeling amongst our communities? No, actually, I think it's positive that it's released a huge depth of feeling, because through that depth of feeling, we need to take action. We need to see this as us all working together to take action. Addressing racial injustice and discrimination is not the responsibility of the BAME community, it's the responsibility of all of our communities, and that's certainly the approach that we're taking in our organisation. I joined the REN Network meeting last week, and I'm going to go again next week. And it was a powerful meeting, especially because emotions were running high. The combination of, I think, the impact of COVID, but directly because of the impact of George Floyd's death. And I do thank members of the REN Network who are so open and honest in being able to share their experiences, because it takes courage. It takes courage for people to really step forward and say, this is how it feels for me. So I think it's really important, and certainly conversations Sue and myself have had as Chair and Chief Exec, and you'll have seen that in the blog that was posted yesterday. We want to encourage more people to talk about it. I think it was Lucy who joined the call last week, talked about the importance of beginning the conversation rather than holding back for fear of saying something or getting something wrong. Sometimes just initiating that conversation through a BAME colleague, asking how they are, is a powerful way of showing that solidarity and support. So please, you might not feel comfortable, it might be something you've not done before, it might be new, but opening up that conversation is going to be very much appreciated. And I've certainly been holding on to reflecting on the REN network and that message last week, and it struck me, so I've been mentoring somebody for a while who is a BAME colleague from another organisation, and I was about to start mentoring somebody through the Think Forward programme. So learning from them, I just reached out to them afterwards just to say, do you know what, we've not been in contact for a while due to COVID, this is all going on, this is how it's feeling for colleagues in my organisation. I'm here to have a conversation, to listen and to learn, to find out what's going on for you. So please take that leap if you've not done it already. It really does signal really what matters to us. So another way in which we agreed last week that we wanted to also, in a very symbolic way, this is not through words, this is through our actions, show our solidarity with colleagues and the Stand Up to Racism is taking the knee. And I know other colleagues have been doing this since, so this is a collage of people that took part on Friday and over the weekend. If you want to have your photo added to this collage, then please do, because this is, again, just another way. And there's been lots of other stories and experiences shared through Twitter and social media in particular, lots of different ways in which people find it easy to connect. So thank you to all my colleagues who are there in those photos that took part in that. I think John's on the call, he usually is, he tries to join us every week, and John's been at this week, the Bank Forum. Last week he joined us at the Race Equality Network, and I know he does on a regular basis. John is out and about through virtual form at the moment, and he's responded in many ways. He has been to some of our inpatient sites as well, where they've asked him to go. He's always there if you need that support direct from the Freedom to Speak Up Guardian. So we just wanted to reiterate that hasn't changed at all through COVID, and actually it's been really valuable. Certainly the feedback that John's been able to share with those questions been able to raise, so please continue to use John as a really valued and important way of giving feedback, getting any concerns raised, and if there's anything that you need support with. So I wanted to talk a little bit now, and I've alluded to this a few weeks ago, that we want to go back out and get some feedback from staff across the organisation. So this stems back to the work that we launched last year around our Culture Collaborative, and hopefully some of you will have seen the blog, and I talked about it a few weeks ago on one of these weekly webinars. Getting the right culture across our organisation couldn't be more important for the direct impact it has on the health and wellbeing of our staff, and therefore the care and support that we provide to those who use our services. And we've done quite a significant amount of work pre-COVID on getting feedback, refining with staff what was really important in terms of direct impact on your experiences of coming to work, what made a difference for wellbeing, what good leadership looked and felt like. And we managed to hold a face-to-face, shock horror, just before COVID, engagement session with staff. And again, it was really powerful to hear stories of staff that worked in the organisation for many years. A couple of them that came that had never been engaged in that way before, to just hear what it was like for them coming to work every day, often out of hours, working in an isolated role in one of our community bases. And unfortunately, we couldn't conclude the face-to-face at the time, but what we've done is, through managing COVID, really tried our best to manage our organisation and our services in a way which was focused on those areas of culture that were important. So focus on the health and wellbeing of our staff, how do we get the right communication and messaging out, how are we really clear in terms of what our purpose and our priorities are at the moment, how do we empower managers and teams to have a flexible, agile approach to how they work, because that was some of the feedback that we were getting. People wanted more flexibility and more agility and options in how they did their working day. And some of it I think we'll have got right, and some of it we won't have got right, because such is life, and we're all human beings, and what's right for one is not always right for the other. But one thing that's really important to us as an organisation is to continue to get that feedback. not only for what we've learned through COVID. I know that we're going to continue to manage our services with COVID in mind, but for our broader way in which we lead and run the organisation. So what we're going to do is, learning from the work that we did last time, a big piece of work has been done, and this is bringing together the evaluation framework Saidi and Richard have been doing, the work that Angela and Tracy have been leading around staff engagement. Is we're going to come back out with a engagement platform using Your Voice Counts. So we're going to start to ask some questions. First of all, some closed questions to get some quantitative data, and then some open questions to get more of a feel of experiences and ideas. So look out for that. We'll be launching it next week. So you're going to get plenty of reminders, and we're going to run it for 3 weeks to give as many people an opportunity to be able to respond, because I appreciate people are generally very busy at the moment, so we don't want to have too short a window in order for you to give your feedback. So look out for that, and I shall be talking about it again next week. Right, World Olympics. So whilst the International Olympics were stood down, it's great that here at LYPFT we had our very own Olympics, and there was great representation from many countries around the world. And it was fantastic, and there was a huge innovation, huge creativity, and you'll see there this is all down to the original ideas of Vicky Search, Sarah Hickey and Sophie Pitton, and our OTs doing a fantastic job. And there was great engagement from staff and from volunteers and service users. And here's some of the pictures of some of the activities. I'm not sure you'll see them in future Olympics on the international stage, but we thought we would. Now the official results have been revealed, to show you what the final top 3 were. So in 3rd place, next slide, drum roll, Barbados won. Barbados has now relocated to Ward 6 at the Newsom Centre, so bronze medal goes to Barbados. Well done to Ward 6. In 2nd place, a bit closer to home, just over the border, Scotland has now come down to Yorkshire and is situated in Bluebell Ward at Clifton. Well done to everybody at Bluebell. And not that it's a fix, but 1st place goes to Great Britain. Hooray! Well done to Westerdale at Clifton, and well done to everybody that took part. I'm sure we're all delighted with the outcome. Commiserations to those that didn't make the top 3, but we can all take pride that Great Britain took the gold medal. Well done, everybody. And I've got some more great reasons to be proud to share this week. Obviously, you'll have seen through social media and some of the comms that we've been sending out, this week is Carers Week, and there's a huge amount of pressure on our carers every day of the year, but absolutely more so because of the pandemic. So carers' usual access to support networks, respite arrangements, space for themselves, the fact that other services haven't operated in the same way, we know has put an immense amount of pressure on our carers. And you'll see Kathy, who's leading this work for us, has been really passionate and done a lot of work over the last few months in terms of our own organisational approach to support our carers. And you'll have seen, I think it's from Ward 1 at the Mount, they've been sending cards, thank you cards out to carers. We've been signposting and connecting people. We've still been having virtual ways in which people can connect and get that kind of mutual support. So if you've got any examples of work that you've been involved in that you want to showcase, please send them in. Please use social media. The more we celebrate the positive practice, the more we inspire other people to get involved and do the best that they can to support our carers. I also want to mention, and again, if you've not read it yet, our Race Equality Network, which, as I've said, meeting every week, are doing a series of blogs. So members of the network have done I think all credit to them, taking the time to put down on paper their experiences, what it's been like for them through COVID and broader in terms of experience of mental health and family cohesion, in terms of their religion and custom and practices, and how that all comes together and makes them who they are as a person. So this week's is by Balvinda, and again, you can go onto the website and find those, and they're also circulated on social media. So a huge thank you to our members of our Race Equality Network. I've mentioned the Ward Olympics and the fantastic work that they've done, and then I just want to finish with, so I was emailed by somebody, a senior manager over in North Wales last week. So I wasn't aware that our Your Voice Matters team and Easy on the Eye team had been doing a fantastic piece of collaboration with colleagues over in North Wales So we know, our team here in the Trust, always go over and above supporting colleagues, other organisations, making information accessible for people with a learning disability or different communication needs, in order to overcome the barriers that people have accessing mainstream health and care services. That's all free to access on the website that they produce. So it's Dean and Julie that have done this work in particular. Dean, who leads on the design, and Julie, who is the lead of the health facilitation team. And they've done all this work with colleagues in Wales. So that's a national programme in Wales where they, through partnership with Dean and with Julie, are now rolling out their own approach of easy on the eye for the citizens of Wales. And they're hugely grateful, and I think we just need to say a huge thank you to them. This partnership in our title for a reason, because it's not just about the work that we do directly for ourselves and our own citizens, but while we have stuff working really well, we should celebrate the ability to work across boundaries and share that with colleagues in this case, in other parts of the UK. So thank you to those. So the only question that came in is the one that I referenced, which didn't manage to get to the inbox because I didn't forward it on, but I picked up about the access to face masks. Last week there were a couple of questions that I know Maureen kindly picked up for me, just about distribution of food supplies, which they have changed in response to that feedback, in order to make sure everybody knows where the food is at the Becklin Centre in particular. I've been starting to get a couple of comments back now and messages from staff that perhaps we're providing more food than people are now using. Obviously, as time moves on, people's circumstances change. So we're just going to have a review of that to make sure that we've not got, again, some of the concern was we've got food going to waste, and that doesn't feel right at the moment, especially. And last week I did suggest if there is an excess, then please do forward it on to food banks if it's appropriate to do so. And that there was a question last week around the security barrier being open, and the reason that's open is because of the issue of minimising touch points for people from an infection prevention point of view, and that was some of the feedback that staff had raised. They wanted the barrier open. So as ever, it's a fine balance. What works for one doesn't work for another, but we're always open to any suggestions of ways in which we can improve our current arrangements and take as pragmatic a view as possible. So that's it in terms of the slides. Let me see what we've got.
We've got two questions, Sarah. Okay. One from Michael, who's asking what plans are in place to open outpatients for face-to-face contacts for medical appointments and psychology and psychotherapy consultations, please.
So that all forms part of the site-by-site reviews that are taking place at the moment. So that's going to cover all of our premises where our community teams operate out of, including psychology and psychotherapy. So there's numbers of factors in that. Which premises do we use? How do we make them COVID secure? And once we've done that, how much clinical activity can then take place out of those sites? What do we need to balance in terms of face-to-face, and what can we safely continue to do remotely? Because again, still wherever possible, it's maintaining that social distancing. So that's the work that's taking place over the next 4 weeks, site by site, across the Trust. So we'll be able to communicate more once that's been completed.
Thank you. And the second one is from John. He's asking if non-clinical staff can make their own face coverings, which will cover the nose and mouth, even though we are offering to supply them, please.
So once we're supplying them, because this is going to include guidance on how long to wear them for, how to dispose of them, etc., then our preference would be use the ones that we're supplying, even for non-clinical staff. And that's why there's a bit of work going on behind the scenes, because what we don't want is people to inadvertently become at risk. Because if you are not complacent, well, if you don't fully consider how you're using a face mask in what setting and what type of face mask you're using, then ultimately you're still exposed to COVID through other means, such as reducing social distancing and touch and so on. So that's the guidance. I know some of it was being signed off today that we're aiming to get out by the end of the week. Thanks everyone. See you all next week. Bye.